in thinking about, so what is treatment then? Well, treatment is going to likely be of three major components. And you might have some of all of these, or you might only use one. So surgery. So in some cases, surgical removal of the tumor can be critical. In others, it's not important at all. It's only important because it's more disseminated disease, so removing this piece won't fix everything else. But we might want a biopsy to get us the diagnosis. Chemotherapy is a big part, and that's what we primarily do as oncologists. And chemotherapy is like saying the word antibiotics. It's a class of drugs of which there are many, many drugs. Certain drugs work well for one thing, other drugs work for something else. And so you have to figure out what's the right combination of medications that will give the best outcome for this particular tumor. And that's been done through these clinical trials over the year that we've all participated in, that we can figure out which drugs work best, in what length of time, in what combination. And so that gives us the guidance to know what to do with that. The third category of treatment after chemo is radiation. Radiation is something that we don't use a lot of in pediatrics because it can have damaging effects on growing and developing tissues, including the brain. So brain tumors being a common thing that we see, you want to avoid radiation if you can in young child because it's gonna have some significant side effects. Radiation to the whole brain is in a young developing child. So surgery, chemotherapy, and radiation are the categories. But then within that, there are some nuances, right? And so there is, for radiation, there's different kinds of radiation. And you'll hear names like gamma knife might be something that you hear thrown out. More recently is proton beam radiation. And so that is a newer modality that has less damage to the surrounding tissue, so less collateral damage to what you're trying to treat, but radiation has that. In chemotherapy, in addition to the individual drugs and the combinations, there's intensity, right? And so people hear about bone marrow transplant or stem cell transplant. That's a kind of chemotherapy. So bone marrow transplant is really related to very high dose intensive chemotherapy. And what you're doing is often, in a case of certain tumors, let's talk about neuroblastoma, you're taking the bone marrow, which is not affected, from the patient, freezing it away, storing it, and then treating the patient with super high doses of chemotherapy to get rid of the tumor. Like doses that you could not survive if you didn't have some marrow stored back for you. It would wipe out your bone marrow forever. So the side effect itself would be deadly if you didn't have the bone marrow that you saved and froze to give back to them, which will repopulate. So it is super intensive. It's about as intensive as you can get, right? So in that case, the therapy is that very high dose, lethal dose of chemotherapy that you're rescuing them from with their own bone marrow.